This exercise is called Patella shaking technique. It's a fantastic rejuvenation technique that really helps the knee feel really, really good, as well as get more blood flow to it and stretch and mobilize, which just brings more flexibility and movement to the patella or the kneecap, which is where a lot of the problems are caused. So what you want to do is you actually need 2 chairs. You're going to get in that neutral spine. You can go ahead and rest back into that chair. Place one foot up as best you can. I'm going to roll up my pants just so that you see this. So it's really, really cool technique. Around the kneecap or the patella is a floating bone, which means that it's essentially not connected to any other bone. It can move around. It's connected by tendons and whatnot, but you can move it around. So if you can see that the knee actually has to be straight. So the patella is not going to move when your knee is bent. You can't move the patella. But when it's perfectly straight, then you can go ahead and feel that kneecap kind of float around. So this technique, what this does, there's 2 parts to this technique that we're going to be doing in the Feel Good Knees program. You're going to take your hands like this, the edges of your hands, cup it right around the kneecap. I'm going to turn my knee just so that you can see this. But your knees are going to be, and your toes are going to be straight up towards the ceiling. I'm going to turn mine just so that you see this. What you do is you want to start to vigorously go like this. It's almost like you're massaging quickly the sides of the knees. So you don't want to just do the skin just a little bit. You really want to get in there and feel that kneecap. The kneecap will be rotating back and forth. So feel like just like this. You just really start to feel some good stretching and blood flow in that knee. So you want to do it absolutely as fast as you can for 10 seconds. So this is the part 1 of the patella shaking technique. And then as soon as you do that for 10 seconds, you can feel it already. The blood flow is moving pretty good. You're going to want to take your hand, the opposite hand, and you want to shake it. So I'm shaking it down to up, front to back, as fast as I can, Like I'm shaking it. Just like you're shaking up like a pop bottle, say you're about to spray. Shake it as fast as you can, and then when I want to go laterally, which just means side to side, I take my other hand and shake it this way. If it feels more comfortable to use your other hand, it doesn't really matter which hand you're using, but you want to get some good movement and good speed. That's really the key to this patella shaking technique. So you want to move fast and get as much range of motion as you can in that patella. What that's doing is the shaking is bringing a ton of blood flow and nutrients to that area. So say it's an injury, or say it's just an old chronic condition that you've had for 30 years. It's telling your body that there's something going on here, and it's flooding nourishment to this area. So the shaking or the rocking with your hands starts the process, and then the shaking helps finish that process. So you do 10 seconds one way, just like this, and then you do 10 seconds the other way, just like that. So again, that knee, the leg has to be straight. If it's bent at all, it's not going to work. The kneecap's just not going to move. So you really want to straighten it. If you can't straighten your leg, you just want to rest your leg up on something, and just try to straighten your leg without feeling any pain. You just want to go to your range of motion as far as you can, and then back off, and then down, and then back off. The goal is to get to the point where your knee can straighten so that you can do the technique. But if you can only straighten your knee like this, well, I don't want you to force your knee down, force your leg down. Just keep your knee bent and just slowly start to work a little bit, doing small pulses. That's going to help develop some flexibility and some mobility within the knee. But when you can straighten your leg, that's what the technique is called, the patella shaking technique.